Dr. James Lawler says COVID-19 vaccines were among the U.S.'s greatest gifts to mankind, but admits they didn't get the messaging right. They lost the public relations game. Now, if another pandemic hits, experts are worried we're heading down a very dangerous path. It was the name given to the vaccine project meant to change the world.
It's called Operation Warp Speed. That means big and it means fast.
And according to the men and women at Nebraska Medicine, it did.
The data is incredibly clear if you look at it through an objective lens, that the vaccine when it came out was truly almost a godsend.
Dr. Mark Rupp is UNMC's Director of Infectious Disease.
The feeling of impotency was just vanquished when we had a vaccine that was amazingly effective and very safe.
Dr. James Lawler agrees.
Huge. Saved millions and millions of lives in the U.S., probably saved tens of millions of lives globally. Probably more.
Many healthcare workers call this the light at the end of a very dark tunnel, even getting emotional as they talk about it.
The vaccines got FDA approval by December 2020. There were signups, long lines, Pfizer or Moderna, multiple doses weeks apart. Rupp says they've learned a lot over the last 5 years.
It clearly put a dent into the transmission of the virus and the impact of the virus. Over time, as the virus has mutated, shifted, new variants emerged, we realized that the vaccine wasn't as long-lasting as we would have liked.
According to the CDC, by 2022, 80% of adults had received at least one dose of the COVID-19 vaccine. And this is vaccine data from January 2025. Just 20% of adults are up to date. So why aren't as many people dying from COVID? Is it the vaccine or is it another term, herd immunity?
That idea that I think, unfortunately, a lot of scientists and healthcare professionals put into people's heads that viruses and pathogens like this inevitably evolve to become less severe. That's a fairy tale. Imagine, let's say you had an island nation that for some reason still had never seen SARS-CoV-2 before now, and you were to take the current virus and introduce it into that population, you would see exactly what you saw in early 2020.
But all the medical experts we talked with agree on what went wrong, the messaging.
So we were clearly gaining ground, but we were losing ground on the side of really public response, public health. Suddenly everything became polarized, politicized.
I think the public health community lost the messaging game very early on and never were able to regain it. And it was lost because of a lot of mistakes and missteps. There's low risk to the American public. We don't have evidence that there's human-to-human transmission. It's not airborne. The public shouldn't be wearing masks. And then all of a sudden the public should be wearing masks. All of these confusing messages really undermined trust.
Rupp even criticized the name of the vaccine program, Warp Speed.
People immediately got the idea that we were cutting corners, that we were sacrificing safety in order to get this vaccine out as absolutely quick as possible.
All of which he says are not true. Angela Vasa is the director of biopreparedness at Nebraska Medicine.
What we knew was changing day by day, and I think that there was not always good communication up front about why the changes were occurring.
All of this on top of mis- and disinformation.
Information that was erroneous and in some ways deliberately misleading because of different people's agendas came to dominate a lot of the public's perceptions.
I think we have a lot of work to do since COVID to rebuild trust in the healthcare system and in our public health response.
Now, a very real concern that the lack of trust could have long-lasting implications.
I think our response would be much worse now than it was in 2020.
One of the bad things is that memory is short and we don't recognize some of the lessons that perhaps should have been learned and are setting ourselves up for, unfortunately, failure as we go forward.
If you would ask the average American to tell you about COVID, in terms of, what is the disease, how is it transmitted, how do you protect yourself, most of what they would tell you is wrong. And ultimately, that's our fault.
So, what's next? The experts here say the time to invest in research, treatment, and vaccines is now, and that includes on current circulating viruses like the bird flu, because they say it's not a matter of if the next pandemic hits, it's a matter of when.
Still ahead, the strategies local restaurants and businesses came up with to survive the pandemic.
Why hand sanitizer? How did that work?
Well, hand sanitizer, we have a distillery, so we had the ability to make it, and there was a huge need.
Plus, the push for mental health help for all ages in the wake of months of lockdowns.
Globally, there's been a 2-time increase in mental health concerns for children.